Teenage pregnancy is a huge social problematic, which I don't know why surprisingly, social media has romanticized it. So I'm going to break that mistaken perception and I'll explain alternatives for an unwanted teenage pregnancy. But first, I'll explain what is a teenage pregnancy, why is it wrong, and its risks and impacts. Teenage pregnancy happens when a girl between 10 and 19 years old becomes pregnant. According to the website of the government of Mexico, in Mexico, more than 340,000 births every year are from mothers under 19. This can be dangerous. Babies of adolescents may be born too early with low weight or with health problems. Compared to women aged 20-24, adolescent mothers can face higher risks of eclampsia, which is a condition caused by preeclampsia, a blood pressure condition that occurs after 20 weeks of pregnancy. Eclampsia is when a person with preeclampsia develops seizures. Before having a seizure caused by eclampsia, the body usually gives warning signs like severe headaches, difficulty breathing, nausea or vomiting, trouble urinating or not urinating often, abdominal pain, especially on the upper right side, blurred vision, seeing double or even loss of vision, and swelling of hands, face, or ankles. They can also have risks of infections and endometritis, which is inflammation of the lining of the uterus, adding that they can stop their education, reduce their chances of work, and increase poverty and discrimination. Teenage pregnancy has emotional, physical, and social impacts. Emotionally, girls may feel fear, anxiety, or sadness. Physically, their bodies are not fully developed, so pregnancy can bring complications. The official page of World Health Organization says that globally, the adolescent birth rate has decreased from 64.5 births per 1,000 girls in 2000 to 41.3 in 2023, but progress is uneven. Sub-Saharan Africa still has the highest rate at 97.9 per 1,000, and Latin America and the Caribbean at 51.4 per 1,000. Girls with less education or from poor families are more likely to become pregnant, which increases inequality. Sadly, social-cultural factors like poverty, lack of education, and limited opportunities increase teenage pregnancy rates. Addressing these issues through support policies, access to schooling and economic training can reduce unwanted pregnancies. Volunteering programs that provide sexual education to low-income communities can also change lives. There are also different ways to prevent pregnancy, like hormonal methods, pills, injection patches, rings, and implants. They are effective but need discipline. Barrier methods, condoms, male and female. They also protect against sexually transmitted infections. Emergency contraception, the morning after pill used within 72 hours after unprotected sex. LARC, long-acting reversible contraception. LARC is the special group of contraceptives that are very effective and easy to use. They include IUDs, intrauterine devices, and implants. IUDs, small devices placed in the uterus. Copper IUDs can last up to 10 years. Hormonal IUDs can last 3 to 7 years. Implants, a small rod placed under skin of the arm. It releases hormones and prevents pregnancy for about 3 years. LARC methods are 99% effective and do not require daily action. Once placed, they work for years, but they can be removed any time the woman wants to get pregnant. Besides these methods, it's important the sexual education and trust between parents and their kids, so they can feel comfortable to tell them parents they are ready to start a sexual life. Explaining that it's better to start a sexual life in an older age is also important because it's not the same starting a sexual life at the age of 14 as is at the age of 20. There's a lot of physical and psychological changes. Starting a sexual life brings a lot of emotional impacts. If a teenager becomes pregnant, there are options. She may continue the pregnancy and raise a child, give the baby for adoption, or choose abortion, if it's legal in her country and state, which in my opinion abortion should be legal everywhere. Do you know that the mortality rate is higher in births with a rate of 12.3% than in abortion, which has a rate of 6.6%. This according to the website of the government of Mexico. It is important to have medical and emotional support to make the best decision. For abortion, there are two main types. Surgical abortion, which is a medical procedure in a clinic to remove the pregnancy. It is safe but has risks like infection or bleeding. Medical abortion uses two medicines, mifepristone and misoprostol, usually before 11 weeks. It can all be done at home with medical supervision. It feels more natural but causes pain, bleeding, and other side effects. Follow-up care is important. In conclusion, teenage pregnancy is not only a medical issue. It is also affects emotion, education, and society. By giving sexual education, promoting communication, and ensuring access to contraceptives, especially effective methods like LARC, we can help young people make responsible decisions. Every teenager deserves the chance to study, grow, and build a future without the problems of an unwanted pregnancy. Thank you.